Hello and welcome to yet another episode of the Haider Rifaat Show, and I'm your host, Haider Rifaat. While millions and millions of people have chosen to self-isolate during this global pandemic, there are also millions and millions of doctors, healthcare professionals who are risking their lives on a daily basis for us. Many have lost their lives battling this virus, but there appears to be no mental relief for them. On the other end, the global economy also continues to suffer miserably because of this virus. I'll be discussing these two issues at length, but first, take a look at this package that I've created. COVID-19, infamously known as coronavirus, was declared a global pandemic by the World Health Organization in March 2020. The virus originated from Wuhan, China in late December last year and has spread across the world to more than 190 countries. The United States has become the new epicenter of the disease, with majority of the cases being reported in New York City, while Italy, China, and Spain also top the list of most infections. During this pandemic, decline in mental health of frontline medical professionals across the world is a call for concern. Many have lost their lives serving the greater cause of humanity. While medical workers are strenuously giving back to their communities affected by COVID-19, there appears to be a lack of psychological relief for them. Anxiety and stress have only worsened the mental well-being of healthcare workers. A new study published in the Journal of the American Medical Association examined 1,257 healthcare workers spread across 34 hospitals in China who dealt with the coronavirus outbreak. Frontline healthcare professionals were the core of the study. The results were alarming, to say the least. 50.4% of the respondents reported symptoms of depression, 44.6% had symptoms of anxiety, 34% reported symptoms of insomnia, and 71.5% reported feelings of distress. The virus continues to have an unprecedented impact on the global economy. Dow Jones Industrial Average and Financial Times Stock Exchange have witnessed major one-day declines since 1987. According to a March report, the Organization for Economic Cooperation and Development reduced its 2020 growth for almost all the economies. The travel industry, lockdowns across the world, and slow-paced businesses have only made things worse. Joining me now in the studio to discuss further the impact of coronavirus on the global economy is health economist Zeynab Ameer. Thank you so much, Zeynab, for joining me.
You're welcome.
For those viewers who do not know the core difference between a pandemic and an epidemic, would you like to clarify?
The difference is pretty simple. An epidemic is basically a disease or an outbreak at a national level, while a pandemic is a disease or an outbreak at an international level.
Considering statistics, the global economy continues to suffer at the hands of this virus at an exponential rate. Are there any chances of recovery?
The chances of recovery basically depends on how fast a vaccine is discovered. For a vaccine to be discovered, it usually takes 6 to 12 months. Well, that depends on the pharmaceutical company and their research and development center.
So you do not see any chances of the economy recovering prior to this period?
No, not as such.
The health sector is also facing a lot of struggles. So what are those struggles considering these economic challenges?
For a resource-constrained country, the economic challenges are pretty grave in a sense where the health sector is pretty underdeveloped. For a resource-abundant country, those health sectors are pretty developed. While in Italy, we saw a very perplexing situation. The health sector was very burdened by this pandemic, while the health sector had enough resource, but the country itself wasn't prepared enough for this pandemic.
So what other challenges in the health sector are you seeing so far when it comes to
The resource constraint,
the equipment?
the human capital like the doctors and nurses, the number of them matching the number of patients, the ratio is pretty high and the gap is pretty high. Well, and the vaccine itself.
Zainab, in your view, how many months or years, so to say, will it take for the global economy to stabilize completely?
For the global economy to stabilize completely, it would basically take 8 to 12 months. This time period is exclusively for the vaccine development, and it basically depends on how affordable and accessible this vaccine is to the general public.
And what will be the impact of COVID-19 on the socioeconomic indicators?
The foremost socioeconomic indicator is basically the daily wage income, and for the daily wage worker, his income is lost because of this pandemic, as well as there's food insecurity. And because of this food insecurity, there can be malnourishment among children. The travel industry itself is paralyzed because of this pandemic.
And very lastly, I want to also ask you the socio-economic challenges the underdeveloped, developed, and the developing world has to face collectively. And what are the mutual challenges that you cite here?
The mutual
That are
challenges
common to all.
that I cite here is that we weren't ready for this pandemic. A resource abundant country and a resource constrained country, both of these countries have a problem in managing this pandemic, where they haven't discovered a vaccine. They don't have enough equipment to manage this pandemic, as well as they don't have proper SOPs to follow through this pandemic.
Great. Thank you so much, Zeynab Ameer. It was a pleasure having you. And joining me now to discuss how this particular pandemic is having a mental toll on frontline healthcare workers is clinical psychologist Aliya Hayee. She's a lecturer at Shahid Zulfikar Ali Bhutto Institute of Science and Technology, Zabist, in Islamabad. She's also currently pursuing her PhD from Quaid-e-Azam University. Thank you so much, Aliya, for joining me. I'd like to begin by asking you, what are some prevailing mental and physical challenges that these healthcare workers have to face because of this pandemic?
Thank you so much, Haider, for taking me on board. You are very right in this. This pandemic is challenging for everyone in the world, especially the healthcare workers, as they are at the forefront fighting for all of us. Being a family member and a doctor, they are sacrificing more than anyone can ever imagine. They are staying away from their families 24/7 at the hospital and emotionally distancing themselves from their loved ones. This emotional challenge is causing continuous strain, and they are more at risk of developing chronic stress, depression, anxiety, and other psychological problems. So I think it's more challenging for them than the common man.
And what are some effective coping strategies that these healthcare workers can adopt to not just help themselves, but to also help the community that is around them?
We already know that if you see a positive and a smiling person in front of you, half of your worries will be lifted. Same goes with this situation. As a doctor, as a common man, we need to develop our strength by giving continuous messages to our brain that we will be able to beat this problem. We will be more stronger than this virus. So when you are giving these messages unconsciously, you are developing your immune system, you are developing your strength. We know our brain is in control of everything. If your brain is stronger, if your body is more strengthening, and its immune system is at its best, you will be able to survive this. That's the only surviving key in this situation. So build your immune system by considering that you are in control of this situation.
But Alia, don't you think that it's the responsibility of psychologists from across the world to be readily available in hospitals to cater to the mental needs of these, specifically the medical staff and the doctors and the health professionals?
Yeah, you're very right. We need psychologists in the field. We need more people out there in the field working alongside healthcare workers. But unfortunately, very few of the psychologists that I'm aware of are providing sessions through Skype, through video calls, through WhatsApp. We need more people. We don't need virtual realities. We need someone in the field to step up and take hold of a person's hand, not literally taking hold of a person's hands. I'm saying not to put yourself in danger, take your precautions, but be there for the ones who need you. Moreover, our government should involve psychologists in the process, because unfortunately this field is being stigmatized in the society. So if you want a psychologist to voluntarily work, provide a space as well where they are not barred to enter different institutes, different healthcare facilitations just because they are not authorized. So government should be involving psychologists, And ultimately, I am sure and I trust my fellow workers that they will come out and they will help people by coming out of this mentally challenging problem and situation.
Now, amidst this pandemic, we have been told constantly to wash our hands excessively, using hand sanitizers excessively as well. So, hasn't this taken a greater mental toll on OCD patients or the people who are suffering from OCD?
This is the most common belief that the OCD sufferers are the germaphobes, they are the hand washers, they are the clean freaks. But in actual, this is reality too. If you are diagnosed with OCD, the chances of recurring that particular symptoms in an intensified forms are most likely. So if a person is ever been diagnosed with OCD, with anxiety, or with any paranoid tendency, it is most likely that their symptoms will be intensified or will be doubling in coming days. So it's better to seek therapy and counseling from your psychologist before it becomes worse for you. The ones who are not diagnosed with the OCD but they have tendency, most likely this situation again increase their behavior. Even the common man has more chances of developing anxiousness, more chances of developing paranoia and the feeling of having germs on their body, and they will be more concerned about their health than in their routine life.
Thank you so much, Aliya. It was a pleasure having you on the show. Indeed, global economy and mental health are key issues to take into consideration during this very pandemic. It is also very important for the government officials, the government itself, and economists from around the world to make certain important decisions and make sure that the economy does not plunge down the drain. The role of psychologists is also very crucial for not just the general public, but also for medical healthcare professionals. That is all for now. Stay tuned for more videos and more weekly updates on my official YouTube channel and Facebook page. Until then, take care. Bye bye.